Now we move on to our next topic. Our next session is on ISA guidelines by Dr. ANJALI BHURE Madam. For this session, I request our chairperson Dr. Shakil Momin sir and Dr. Ganesh Limay sir to please come on the stage. Dr. Shakil Momin sir is alumni BJMC Pune. He is a very senior freelancing consultant anesthesiologist at Kolhapur since 1981. He is past president at MSc ISA. He is contributory author at Textbook of Anesthesia, author of Me Bhartiya, collection of Marathi poetry. He has created awareness among lay people about anesthesia and published scientific data in IJA. This was the first publication of its kind in world literature. Dr. Ganesh Limay sir is senior freelancing anesthetic consultant since 1993 in Sangli. At present, he is the president ISA Sangli Miraj branch. Welcome, sir. I request the chairperson to please introduce our speaker.
Welcome everybody. I will introduce ANJALI BHURE Madam. She is at present Vice President of ISA National. Experience in anesthesia since past 33 years. She practices obstetric anesthesia, CPR, public awareness programs are of interest and expertise. Many national and international publications she had on her name, and held many posts in position in ISA, and won many awards for Nagpur branch as organizing chairman of MSc ISOCON 2021. I request Madam to continue the session.
Good afternoon all. Greetings from ISA National. I'm going to present the guidelines related to perioperative fasting and feeding in adults, obstetric, pediatric and bariatric population. These are practice guidelines from ISA in the year 2020, which were published in IJ, that is Indian Journal of Anesthesia. Now, ISA National is always concerned regarding the patient care and as well as every ISA member. And this is an initiative by ISA to get these guidelines so as you know, whenever you are alone, you should know what are the guidelines, and based on this, you can accordingly plan your actions related to giving anesthesia to the patient. This is just a summary I am presenting of the guidelines which are already published in Indian Journal of Anesthesia. So, related to preamble, perioperative fasting means nil by mouth before surgical procedures requiring sedation or anesthesia. And in the post-operative period, there is complete avoidance of oral dietary intake till recovery of bowel function, especially in the abdominal surgeries. Impairment or abolition of airway reflexes can lead to pulmonary aspiration of gastric contents. And to minimize risk of regurgitation and aspiration, there should be empty stomach before sedation or anesthesia, and this should be ensured. Now, the critical volume and the pH of more than 25 ml and pH less than 2.5 can cause significant pulmonary aspiration leading to respiratory failure. And this was obtained by Roberts and Shirley on a rhesus monkey, and that was extrapolated to the humans. Now, water-soluble orally administered paracetamol or magnetic resonance imaging, scintigraphy, these are all modern research modalities which has got better insights into physiology of gastric emptying. Now, the newer modalities like gastric ultrasonography is being increasingly used to study the gastric volumes and emptying. Why do we need ISA guidelines? What is the need? So, in India, if you can look upon, large number of surgical procedures occur. There is diverse healthcare setting and differing practicing standards. Some may be at rural level, some may be at urban level, in corporate sectors, in civil hospitals, in the institution. Variation in food items consumed in different regions and states. So it is a diverse thing that every state will have its own way. Social, cultural, geographic and economic factors also play a role. Culture and eating habits similar in countries like South Asia, that includes India, Bhutan, Nepal, Bangladesh. See, these are all the countries which can also be taken into consideration, but there also the diversity remains. And the available guidelines do not apply uniformly across these countries, because when you consider the factors which are mentioned just now, they all differ in every country and states in India. Hence, formulation of practice guidelines on perioperative fasting and feeding by the ISA was thought of. And it has given emphasis on safe duration of fasting before and after administration of sedation or anesthesia for elective, for diagnostic or surgical procedures. Type and quantity of solid and liquid food ingested safely till the fasting is initiated and feeding is restarted postoperatively. General as well as pediatric, obstetric and bariatric population. So these guidelines apply general, then to the pediatric population, obstetric population and the bariatric. Guidelines are developed which are based on country-wide survey conductivity by Indian Society of Anesthesiologists. Current evidence which is available in India and also worldwide. Institutional practice patterns across India and not applicable for patients with risk of aspiration. The guidelines basically focus and has been recommendations for withholding solid and liquid food before elective diagnostic or surgical procedures performed under anesthesia, that is regional or general. Resumption of oral fluids in the postoperative period. The guidelines aims at to reduce the incidence and severity of aspiration pneumonitis, will prevent delays or cancellation of surgical procedures on daily basis, better patient outcome, patient's knowledge of clear liquids, non-clear liquids, what is light meal and heavy meal. Guide in consumption of food items before presenting for elective, diagnostic or surgical procedures. Identify shortcomings in the evidence specific to South Asian countries. Allow formulation of institutional protocols. So to form the institutional protocols, these guidelines may be very useful for us. It stimulates research among the colleagues so that evidence is added in the future. Now, the grade of recommendations, that is assessment, development and evaluation, that is known as grade, to allot the level of evidence of the literature included. So whatever the literature was included, this was based on grade, and the grade protocol categorizes evidence into high, moderate, low and very low. Now, very low means true effect is markedly different from the estimated effect. Low means the true effect might be markedly different from the estimated effect. So first, very low is, it is markedly different. The low, grade certainty shows that it might be markedly different. Coming to the moderate, the authors believe that the true effect is probably close to the estimated effect. And the high means the authors have lot of confidence that the true effect is probably close to the estimated effect. So based on these levels of evidence, recommendations were framed and graded as either weak or strong. So strong means an intervention should be done, moderate means an intervention should be considered, and weak means an intervention is suggested. Certain definitions which are formed in these guidelines are pre-operative fasting. So what does pre-operative fasting means? Minimum required fasting duration for oral intake of solids or liquids prior to administration of anesthesia or sedation, necessary to minimize the risk of regurgitation and pulmonary aspiration in patients devoid of risk factors for regurgitation. Empty stomach state. It is a state when gastric contents reach the baseline volume after the intake of solid, semi-solid or liquid meal. Baseline volume means volume of gastric content of an adult after overnight fasting. So if a patient is fasting overnight, then the morning would be, the volume of the gastric content will be the baseline volume. Residual gastric volume means volume of gastric contents at the time of examination or evaluation. What is full stomach? Presence of solid content or a state of increased volume of liquid gastric contents above the baseline volumes after the intake of solid, semi-solid or liquid meal. Other definitions which are included is clear liquid. So what do you mean by clear liquid? any liquid which takes 2 hours to empty from the stomach in human beings. Non-clear liquid is any liquid which takes between 2 hours and 4 hours to empty from the stomach in human beings. Light meal is any food item which takes between 4 hours to 6 hours to empty from the stomach. Heavy meal means any food which is going to take more than 6 hours to empty from the stomach. So coming down to the adult section, this is just a summary I am repeating. So what are the recommendations and what is a level of recommendation which it states? So clear liquid should be allowed up to 2 hours prior to administration of sedation or anesthesia. And this has got a strong level of recommendation. Second is volume of clear liquid consumed may be restricted to less than 450 ml 2 hours prior to administration of sedation or anesthesia. Non-clear liquids may be allowed up to 4 hours. Light meal may be allowed up to 6 hours. And if the patient has consumed heavy meals, it may be prudent to wait for at least 10 hours prior to administration of sedation or anesthesia. Heavy meal consumption is not advisable the night prior to surgery. So it should always be, the light meal should be recommended. Routine use of aspiration prophylaxis in adequately fasted patients is not advised prior to administration of sedation or anesthesia, but aspiration prophylaxis is advised in high-risk patients as identified by the anesthesiologist. So it is left up to anesthesiologist. H2 receptors, proton pump inhibitors and prokinetic drugs may be used in prophylaxis in high-risk patient. Coming to the obstetric section, women in early or late pregnancy when administered sedation or anesthesia may be considered to be high risk for aspiration. Clear liquids may be allowed up to 2 hours prior to administration. Non-clear liquids may be allowed up to 4 hours prior to administration of sedation or anesthesia in pregnant women. Light meals may be allowed up to 6 hours, and in the pregnant woman, if the heavy meal is consumed, it may be prudent to wait for at least 10 hours prior to administration of sedation or anesthesia. Heavy meal consumption is not advisable the night prior to surgery in pregnant women too. Pregnant women requiring sedation or anesthesia should be administered aspiration prophylaxis. H2 receptors, proton pump inhibitors, either alone or in combination with prokinetic drugs, can be administered for aspiration prophylaxis. Clear liquids can be allowed orally 8 hours after cesarean section under regional or general anesthesia. Coming to the pediatric section, consumption of water up to 3 ml per kg should be allowed until 1 hour prior to administration of anesthesia. So for the pediatric section, the duration also changes. They have made it until 1 hour. Consumption of clear liquids other than water up to 3 ml per kg can be allowed until 2 hours prior to administration of anesthesia. Human milk and fully skimmed non-human milk can be allowed until 4 hours. Non-clear liquids, non-human milk, formula feeds, light breakfast, light meal may be allowed until 6 hours prior to administration of anesthesia. The attending anesthesiologist can decide for or against the administration of aspiration prophylaxis in adequately fasted children. The attending anesthesiologist can decide on the duration of fasting for procedural sedation within operating room or at remote location. The oral consumption of clear liquids in the postoperative period should be resumed at the earliest where no medical or surgical contraindication exists. Coming to the bariatric section, obese individual may be considered to be at higher risk for aspiration in comparison to non-obese individuals when administered sedation or general anesthesia. In obese individuals, the advice on the pre-operative fasting practices may be same as in non-obese individual prior to the administration of sedation or anesthesia. Aspiration prophylaxis may be administered in obese patients prior to administration of the anesthesia. H2 blockers, proton pump inhibitors, either alone or in combination with prokinetic drugs, can be administered for aspiration prophylaxis. Now, gastric ultrasonography section has been given a special place in these guidelines because gastric ultrasonography may be used as a bedside tool for assessing the quality and quantity of gastric content in the preoperative period. The quality and quantity of gastric content should be assessed in the right lateral decubitus position. Now, the food items, as we already know that every state, every actually city has got diverse food items which are consumed. So here is a classification of food items into clear liquids, non-clear liquids, light meals and heavy meals. So clear liquid means juices without pulp. Coconut water, black tea, coffee, 25% dextrose, juice, watermelon, pineapple, apple, sandalwood, sharbat, roux afza, khas sharbat, aerated cold drink, Tetra Pak juices, rice kanji, clear soup broths, dal water, and green tea, maltodextrin preparation. Non-clear liquids can be mentioned as rava porridge, ragi mal, sattu, buttermilk, milkshake, fruit yogurt, cold coffee, filter coffee, smoothie. So we can just see that authors have really taken pains to find out what the population is making use, what food items are used, and that has been classified accordingly. Light meal, what does light meal include? It can be bread slice, cream of soups, curd rice, dal rice, fulka, vegetable, one with 4 spoons of vegetable, curd, milkshake with fruit, milk and cornflakes, idli sambar, poha, puffed rice, Mary biscuits 4 in number with milk, glucose biscuits 4 with milk 150 ml. Heavy meal would include thali, that is chapati, rice, dal, vegetable curd, noodles with curry, pongal, dosa with chutney, sambar, thali rice, poriyal, sambar, curd, pickle. So all these list of food items are there for our help. In case we need to go through the guidelines, then everything is mentioned here. This will be very helpful to us, especially when we are inducing the patient alone, or sometimes in some kind of litigation, maybe the opposite party can even procure these guidelines to see whether whatever was done by the anesthesiologist was done properly or not, and as per the guidelines. So these guidelines would be very helpful to us when we are isolated or in case of litigation. And this has been properly placed in a diagram, less than 2 hours, between 2 to 4 hours, 4 to 6 hours. So it goes as clear liquid, non-clear liquid, light meals and heavy meals. And these are the guidelines, and this is a source from where you can procure these guidelines. We haven't gone into the detail, we have just presented a summary. So, because ISA National wants to promote these guidelines and they want to bring it to every anesthesiologist, even at the periphery, so that you are aware that such guidelines exist. One more thing I would like to tell you, the recent guidelines have been published in IJ in the recent issue, which mentions about the pre-operative investigation. So please do go through those guidelines also, and it is in the preparation. Maybe in near future, we will be presenting those guidelines also. And it is a good news for all of us that ISA has got many guidelines in pipeline, which is definitely going to be a very great help to us in proper patient care as well as for our protection. This is a reference, and these are the authors who have really taken pains to make these guidelines. So Indian guidelines related to pre-op fasting and feeding is now available. Thank you so much.
Thank you, madam. Due to lack of time, only 2 questions from the audience and 1 from the chair. Anybody wants to ask?
No, aerated drink should not be allowed. This question was asked in one of the ISA webinars, that what is the use of this ISA guideline. So that time it was mentioned that whether you are aware or not, but the other party will definitely procure these guidelines to see what has been done, whether everything has been done properly or not. So importance of these guidelines, and hence ISA has taken initiative to every time in any national CME we are going to have our ISA guidelines presented.
One question, madam. Are these guidelines have any legal value in court of laws?
That is what it has been said, sir. It was in the day before yesterday only, there was one webinar in which the secretary has said that these guidelines, you can show, definitely will help. And he said that even if the anesthesiologist is not aware, but the opposite party will seek. And these are Indian guidelines which are published in our journal, sir. So it will definitely make a difference.
So now it is a must for every practitioner of anesthesia to follow these guidelines.
Sometimes if a pediatric patient comes to us, we really don't know what kind of food comes in which category. So at that time, these guidelines would be really beneficial to us.
Thank you so much, ma'am.
Thank you.
I now request our chairperson to please felicitate. It is our 75th Jubilee Platinum celebration, and we have the honor of having Dr. Shakil Momin sir on the stage. I request Dr. Anjali madam to please felicitate sir. Sir is a very senior freelancing senior consultant at Kolhapur. He is also the past president at Maharashtra State Chapter ISA. He is contributory author at Textbook of Anesthesia. He is author of Me Bhartiya collection of Marathi poetry. He has created awareness among lay people about anesthesia and published the first scientific data in IJA in 1985. It was the first publication of its kind in world literature. Thank you so much, sir. We are very honored to have you on the stage. Madam, please do the honors.
Now I request Dr. Malvade sir to come on stage and felicitate the chairpersons.
Thank you so much.